Hi, welcome. Thank you for bringing such great weather with you this afternoon. So I want to introduce myself again. I'm Rachel Potter. I'm Dean of the College of Education here at Mary Baldwin. But today I wear a couple of other hats that are relevant to my reason for speaking with you today. I'm a board-certified behavior analyst. I'm also licensed by the Virginia Board of Medicine to practice in that area. But most important, and perhaps I should have put this in the biggest font on this title slide, I'm mom of two boys, one of whom has autism. People sometimes ask me, so is that why you got interested in this field? And actually the reverse is true. So I tell people that I didn't get a get out of jail free card on having a child with autism just because that was an area of academic interest for me. It happens to also be an area of interest for me. I had a passion for special education. That was the field that I studied in school as a graduate student, and it just so happens that one of my children has autism, and I've continued to pursue that as my area of academic interest as my discipline here at Mary Baldwin. I'd like to begin with, some of you may be thinking, gosh, these numbers that you have up here are already out of date. Yes, as of Thursday, these numbers are already out of date. I have the Centers of Disease Control to thank for releasing their biennial report Thursday afternoon. Some of you may have seen that on social media or in the press, but these numbers are out of date, so allow me to update them for you, which helps support my point that this area is particularly important these days. So these numbers represent, first, this 1 in 68, which is now 1 in 59. 1 in 59 children in America age 8 have a diagnosis of an autism spectrum disorder, so 1 in 59 now. 1 in 42 has now been updated to 1 in 37. This statistic represents the number of boys age 8 in the United States who have a diagnosis of an autism spectrum disorder. And the second statistic, also updated, is no longer 1 in 189, is now 1 in 151. Gosh, I remembered that. Represents the number of girls age 8 in the United States who have a diagnosis of an autism spectrum disorder. So what we are seeing are increasing rates in autism spectrum disorder, making this highly relevant. So people ask me, why is this? Why are rates increasing? Is it better diagnostic criteria? Or are we actually seeing higher numbers of individuals with autism? The answer is, well, could be a little bit of both. The scientific community right now will tell you that most of this increasing prevalence is related to better diagnostic criteria, required pediatric assessments at 18 months, 2 years, 3 years, and some other specific ages where children are having regular routine assessments in their pediatric evaluations. We're also seeing clear evidence of genetic dispositions. So with genetic dispositions, we're seeing traits that are being passed on through families, not directly necessarily parent to child, but other indirect familial passing on of genetic traits. So if you have a sibling or a cousin, aunt, uncle who might have autism spectrum disorder, you might see that continue in further generations of families. So we're going to continue to see these rates increase. So that makes this important. So what characterizes an autism spectrum disorder? So I've tried to give you the short version summary up here. These are sort of the highlights of how we know that an individual might have an autism spectrum disorder. So we're looking at deficits in communication. Communication is so much more than just speech, but for many, many individuals with an autism spectrum disorder, that's where this is going to be most pronounced. We're also going to see deficits in social interaction that could be initiating, maintaining, ending conversations, for example. Restricted, repetitive behaviors or interests. So that kid who is completely, so my kid, for example, for a long time was obsessed with prescription medication commercials and can rattle off, all those long side effects of every prescription medication. Kind of an odd thing for a 7-year-old to be a little too interested in. Sometimes a little embarrassing when you're at Walmart and he wants to tell the cashier the side effects of a medication that might be highly prescribed for gentlemen over the age of 60. Could be a little on the embarrassing side. We're also seeing that a lot of individuals on the autism spectrum tend to be either hypo or hypersensitive to sensory input. So what I mean by that is talk about input, either things that we see, things that we hear, might be too overstimulating. On the other hand, some individuals with autism spectrum disorders might be sensory seekers. They love that input. The louder the better, the brighter the better, the flashier the better. So we see both, right? Autism is a spectrum disorder. So we have kids on both ends of the spectrum and anywhere in between. And a child may be hypersensitive in some areas and hyposensitive in another. With my own son, where this is most concerning is that he is hyposensitive to pain. So you might think, great, wow, that's great. He hurts himself and it doesn't hurt. Yeah, that's also concerning when your kid can't report that they're injured because they don't feel that injury. That's very concerning to me as a parent. Comorbidity. So what I mean by that is autism can be concurrent with some other disorder or other condition. So we see that. And again, this notion of autism being a spectrum. Not everybody is the same. Very, very common saying, you've met one kid with autism, you've met one kid with autism. Very true. I do a lot of volunteer work with individuals on the spectrum, and they're all very, very, very different. You have individuals with autism who go on, further their education, get PhDs, become experts in their field. There are also individuals with autism who may never learn to talk, engage in self-care, feed themselves, toilet themselves, who are aggressive, who engage in self-injurious behavior, and anywhere in between. So really, again, this notion that autism is a spectrum, no two individuals with autism are going to be alike in the same way. So applied behavior analysis, and we're going to talk a little bit more about what Mary Baldwin is doing in this area. So I want to give you a little bit of a definition of that before I move into those specific examples. Applied behavior analysis is known as the leading treatment right now, not a cure, but the leading treatment in autism spectrum disorders and other related developmental disabilities. So ABA, the abbreviation, is the application of the principles of learning and the science behind learning and behavior to make measurable differences in socially important and personally important behaviors in a client. So we're taking the same behaviors that have been used in the past, B.F. Skinner, Thorndike, all those researchers, we're still humans as organisms. We're still animals. We still behave the same as rats, pigeons. We're still motivated through positive reinforcement, applying those to help individuals, clients, students make measurable change in things that are important to them, important to their families. That could be learning to speak. That could be learning new mathematical principles. That could be a gymnastics coach working with an athlete to help them right their handstand when they're on a balance beam. So there are applications of ABA in athletics and in fields far beyond just the world of developmental disabilities as well. So MBU already has programs in this field. And I want to highlight what we're already doing, which may surprise you, before I point out some of the new things that we're getting ready to do as well. So special education teacher licensure is something we've been doing here a long time. There are a lot of good things that we teach our future teachers in special education as well as general education to do that include strategies that support individuals on the autism spectrum. We've also been teaching courses in behavior modification here since 1993. Those courses have changed title, they've changed course designation numbers in the catalog over a period of time, but we've been teaching those courses on and off for quite some time here at this institution. In 2010, we started a graduate comprehensive certificate in autism spectrum disorders. This came about when the Virginia Autism Council made a call to colleges and universities saying, we have a need to educate teachers and paraprofessionals or teacher aides who are supporting those teachers in schools to provide an additional 12 credit hours of instruction, including practica, including field work, to provide more support and education than what teacher licensure alone can provide. And Mary Baldwin stepped up and said, we will do that. And so we are one of a number of institutions. Right now, we are the only one in Virginia that offers that 100% online. We didn't at the time in 2010, we do now. So we've offered that since 2010. Since 2012, we have offered coursework toward the credential of a board-certified behavior analyst, that's the credential that I hold, as well as the board-certified assistant behavior analyst, which is the undergraduate version of that credential. We've had a Master of Education in ABA since we launched the coursework toward that credential, and we've had a Master of Education in autism spectrum disorders at the same time. We launched those two together. I've also added on here the Doctor of Occupational Therapy. I mentioned earlier those sensory concerns, the hypo and hypersensitivity. So sometimes you might see that as a separate diagnosis for a child with an autism spectrum disorder, as a sensory integration disorder or sensory integration dysfunction. The experts in the field who have the most training in mitigating that disability, providing training, providing opportunities for growth, are actually occupational therapists. So over at Murphy-Deming College for Health Sciences, we have faculty, particularly Dr. Stevenson and Dr. Hansen, who are working with our students in our OT program to develop expertise in sensory integration disorder and dysfunction as part of their program so that they will be prepared to serve individuals on the autism spectrum or who have sensory integration disorder as part of their role as occupational therapists. So that's also something that we currently have in place as well. So what are we getting ready to do that's new? What's exciting? What's coming up? Here's what's coming up. Launching this fall. So starting this fall, we have a Master of Science in ABA. So our Master of Science in ABA is replacing our Master of Education in ABA. The coursework, for the most part, is the same as what our Master of Education was. What we did is we looked at our curriculum and we said, you know what, this is behavioral science. This is really a science program, and at most colleges and universities, the ABA programs at the graduate level are housed in programs where they are Masters of Science degrees, or they're housed in graduate programs of clinical psychology, graduate programs of counseling and psychology. And so we felt that that was appropriate. Our accrediting agent, SACS, agreed. And so starting this fall, students that matriculate into that program will be seeking a Master of Science degree. Also launching this fall, and we're particularly excited about this, wanted to highlight this for you all. This is our Bachelor of Arts. This is a new major in Autism Studies and Applied Behavior Analysis. This is a new undergraduate major. It's available to our residential students here on campus. It's also available to our online students, so it's available 100% online. This allows our students to take the coursework toward becoming a board-certified assistant behavior analyst, as well as taking the coursework toward that comprehensive certificate in autism spectrum disorders. It does include some fieldwork components so they can have that hands-on opportunity to work with individuals on the spectrum. They're an online student. They can do that wherever they are located geographically. We will assist with finding those appropriate placements. And we also, again, are launching that comprehensive certificate, this time at the undergraduate level. We've only had it at the graduate level until now. We're very pleased to be able to make that available and accessible to our undergraduate students starting this fall. So the other thing, the last thing on here that we're considering doing is developing a 40-hour training for registered behavior technician. This is also a credential in the world of ABA. It is a high school level credential that we hope to be able to make available to students who are maybe freshmen and sophomores here at the institution who want to take that maybe as a May term class, give them some opportunities for summer employment, maybe interest them either in the major or in the undergraduate level of study so that they can continue to further their study, maybe become a board-certified assistant behavior analyst. We're also allowing students, I put in the second bullet here, who want to do that undergraduate major, they can stay an extra year and get that Master of Science degree that I mentioned earlier. So in 5 years, we have, again, our undergraduate students who are residential or our undergraduate students who are in our online program have an opportunity to go all the way through that master's degree and take the coursework they need to become board-certified behavior analysts, not assistant behavior analysts. And then finally, I wanted to close with this. So what does a student get out of this? Ultimately, what is the outcome for a student who does this program? So, or any of our programs, any of our ABA and autism programs. So training in leadership, collaboration, ethics, management, behavior change, de-escalation, and database decision-making, plus an MBU, liberal arts-centered education. What are you going to have with that? Rewarding and plentiful, well-paying, service-oriented employment outcomes in the autism or ABA field, or really any other field. Who wouldn't want to hire someone who has this kind of training and background? Not necessarily limited to autism and ABA. So I think we're producing and are going to be continuing to produce with some of our new options very, very valuable employees. Happy to take any questions that you all have. ma'am. I'm happy to answer that. The question was, what is the difference between Asperger's or Asperger's disorder and autism? So currently, under the new DSM, the new diagnostic manual that's used to diagnose autism, there is no longer a differentiation. There used to be, under previous editions, that was a different diagnosis. So Asperger's disorder was typically used for individuals who did not have a delay in their speech communication development, but had the same delays in social development, repetitive behaviors, some of the other similarities, just not the speech communication delay. Today, nobody would receive a new diagnosis of Asperger's. It is no longer a diagnosable condition. Right now, everybody would be diagnosed, if they meet the criteria, with an autism spectrum disorder. They might be diagnosed as being more high functioning. There's now a level system, a numerical level system. So there are still people today who have that diagnosis because they were diagnosed under an earlier edition of the American Psychiatric Association's diagnostic manual, but nobody now would receive that as a new diagnosis. You're welcome. Yes, sir. I think right now the goal is to improve independence as much as possible for individuals who do have autism spectrum disorder. Each of their goals would be very different. So to the degree that you want an individual, whether it's a child or adult, the client, if you will, to increase their independence to the next level. And that's going to vary individual to individual. So no, right now there is no known cure. Personally, from a parent perspective, as well as from an educator perspective, I don't know that that's what I would be looking for. I think what I'm looking for is quality of life and improved independence, whatever that means, individual to individual. I'm also very concerned that as these individuals who are youth become adults, that there are sufficient services available. That's why these majors and these programs are very, very important for institutions like ours to put into place, because there is a market for people who are coming out of colleges and universities with this training, because these youth are becoming adults and need services from people who have training and background and this expertise.
I have a follow-up real quick. When I work in the juvenile court system, and I see kids that we speculate in the juvenile profession that they may have autism. We have therapists and service providers that say, well, we don't know for sure.
Certainly.
And we don't, you're just pointing this way, we don't know what they're going to do as adults. And it's really something that we like to be, I mean, the language we like to say, well, we're going to cure it. But I think you're right. We just try to make everything
Absolutely, and I will say, actually, I worked for 5 years in a juvenile system. I was a principal of a juvenile detention center, and once in a while we would have detained youth who were on the spectrum, and their parents in particular would worry, oh my gosh, my child has autism, they've been detained. I'm particularly concerned. My child's a special case, what am I going to do? And what I would always reassure those parents of is, your child, while they're here, is under a great deal of routine. They are probably going to be better settled and better acclimated to many of the other youth who are here, because they're going to know exactly what's expected of them almost minute by minute. So actually, I found in our experience that students who were detained who had autism often did particularly well in that kind of a setting while they were waiting and pending adjudication. Do we have time for one more question? Okay, we have time for one more. Yes, ma'am. So yes, there's still a lot of debate, particularly on social media, about what causes autism. As a mom, I don't care. As a mom, I'm concerned with my child developing independence and skills to be happy contributing citizen, but the scientific community right now is continuing to explore. What we do know is that there are genetic factors. What we do suspect is that there are also environmental factors. What we do not know yet is what those environmental factors are. Science has continued to over and over again disprove some of those vaccine theories that have been thrown out there. So I think for the most part, the scientific community has said no, that is not what's happening. There are, of course, parents who anecdotally will be able to explain, timeline, but you also look the time of a child's life where they tend to receive vaccines are also the same time that you start to see those deficits. And so I can understand why a parent might attribute some of those deficits to happening around the same time. But science at this point in time, the medical community has routinely disproved that as being causal.